let's talk about migraine prevention. Today we're going to talk about migraine prevention medication. Last time we talked about migraine rescue medication. So let's switch over to how do we prevent migraines from ruining our lives day in and day out. You thought I was going to talk about medication. Wrong. I am in a minute, but not yet. So first thing I always recommend is make sure we're getting enough sleep, 7 hours at least. Make sure we're getting enough exercise, 150 minutes a week. Make sure we're eating correctly too. Reducing processed foods, enough. Citrus fruits tend to increase migraines sometimes in some people, as well as chocolate. So oftentimes before we talk about medications to prevent migraines or headaches, we talk about try to find some triggers that may cause your headaches and migraines to be worse. Few studies say that exercise, 150 minutes a week, can be just as effective as some migraine medications. If we're doing all those right things and we're still having headaches and migraines, one thing we recommend is supplementation. Magnesium at 400 to 600 milligrams a day is a great resource, as well as riboflavin, which is vitamin B2, and feverfew. Migrelief is a supplement that actually contains all three of those in one pill. After you've tried these things for a month or two, it may be time to step up our game if they don't start working. Now, I start treating people with migraine prevention medications when they have greater than 5 days out of the month with a headache or a migraine. The first ones we go to is amitriptyline, topiramate, and propranolol. These three are the best evidence to help with both headaches and migraines. There's decent downsides of all of them though. So be sure to talk to your provider about side effects and things to look out for with these medications. Sometimes it's hard to know how many headaches and migraines I'm actually getting. So first of all, it's good to track them. They have apps for that. Second of all, I rephrase the question this way usually. How many days out of the month do you feel crystal clear? No head pain, no migraine. If the answer is only a little over half, we're gonna try medication probably to get you some relief while we figure out some of your triggers. Up our game a little bit with the migraine medications, we step into these monthly subcutaneous injections. That would be Ajovy, Emgality, and Aimovig. They all work quite well, and their side effect profile is quite favorable because they're not going through the GI system. If you've tried a couple of those and you had side effects, it just didn't work for you.